The SSP, based upon the theory underlying it, optimizes the neural regulation of the striate muscles of the face and head, which means the ability to regulate those middle ear muscles, to listen better, to change intonation of voice, to gaze, and coupled with that is the vagal regulation of the heart, which is calming. So when we start asking who will work well with the program, it first starts off with those who have a withdrawn or depressed social engagement system. Well, that's a fine statement to make, but most people don't know what that means. So the easiest one, and I moved into this dimension of trying to communicate, was basically saying, send me the people who have auditory hypersensitivities, because that was easy manifestation that people unambiguously picked up on. And it worked well because if people had that, I'd say more than half no longer had hypersensitivities after the intervention. But there were also a lot of other, what we call amazing emergent properties, and they all had to do with the whole integrated social engagement system. So if we backtrack for a moment and say, who would be the most likely candidates? We start off with those who have auditory hypersensitivities. We then move to those who have basically a flat upper face. So we ask the question, does the child show exuberance? Does the adult show exuberance around the upper part of the face? And then we ask the next question, tell me about their state regulation. So with those, and the fourth one, I don't want to forget the fourth one, is we listen to their voice. If the voice is in a monotone or, let's say, a high, narrow, screechy voice, or they're modulating it with loudness and not with frequency, they are also prime candidates. But you'll notice when you start looking at the children and the adults who have auditory hypersensitivities, what are their voices like? What's their upper face like? What's their ability to regulate their state like? So as we become more informed and learn what to look for, we don't see these as independent features. We see them usually as overlapping. As a therapist, you will often see some individuals with isolated systems not working. You may frequently see the auditory hypersensitivity not working while the face works and everything else seems to work. And that can be due to perhaps a traumatic episode of severe ear infections, where the neural regulation of the middle ear muscles was retracted during the inflammation. Because if you have an inflamed muscle, do you want the neural tone on it? It's going to be just excruciating pain. So the adaptive function was a retraction of that. So you may see that as isolated. You're more likely to see auditory hypersensitivities as an isolated factor. But once you start listening to voice and looking at upper part of the face, those people will also most likely have auditory hypersensitivities and state regulation disorders.